Parents and caregivers of children with epilepsy, including those with Lennox Gastaut syndrome, may face challenges coping with cognitive and behavioral issues, often within the first year of their child's diagnosis.
I think the biggest challenge that the parents of children with Lennox Gastaut syndrome face is sorting out when there's a behavior change, what to do about it. And by that I mean what's causing the underlying behavior change. So is a child just having a bad day? Are they upset at their sibling? Did they have some seizures that the parents missed? Is it the new medicine I started? And trying to figure those out at home can be a real challenge for the caregiver.
The behavioral disorders that affect your child may include hyperactivity, aggressiveness, and destructive or antisocial behavior. Many children with epilepsy also have attention deficit disorder and symptoms of depression and anxiety.
How much help the parents need in managing this behavior really depends on kind of the severity and extent of it. Again, for example, if the child has mild cognitive impairment but really not significant behavioral problems, the parents may do fine on their own just with straightforward parent common sense. If the child has significant autism spectrum disorder and Lennox Gastaut, they may need regular follow-up with a psychologist, a behavioral modification plan, and other assistance to help with that behavior.
Just as you keep track of your loved one's seizures and sleep activity in a diary, you should also make note of behavioral issues. Try to be as precise about behavioral changes as you can and report this information to your physician.
We want to be tracking the child's seizures, time of day those occur, and when they're given the medicine, what time that is, and then the behavioral and sleep issues. So when we see them back for follow-up, we can try and put all that together, and if the parents are doing something that's worked, that we also can figure out, do we incorporate that? Does that make sense? What do we need to do?
It's important to discuss any behavioral issues with your physician to assess if your child's medication is a contributing factor. You should also ask about treatment options. Sometimes parents are afraid to discipline a child with LGS, but treating epilepsy means treating the whole child, not just the seizures. Parents should talk to their doctor if scolding precipitates seizures. Otherwise, it's important to remember that under-disciplining a child can lead to problems with dependence or rebellion.
One of the things we have to tell the parents is, you still need to be the parent. You still need to, put appropriate guidelines on this child like you would your other children. Let us help you with some of the uncertainties around the edge, but you've got to be the parent.
You may also wish to discuss options for addressing and correcting behavior with a specialist familiar with the needs of children with LGS.
A lot has changed over the last 10 to 15 years in patients with Lennox Gastaut, and what our expectation is as they go through childhood to adulthood. We have a high rate of survival that we didn't even have, simple as just surviving the catastrophic epilepsy. We have far better treatments for the comorbidities than we ever had, and more families are keeping these children in their homes because of that. These factors all make it even more important that we address all these issues for these children because they're going to be around for a period of time and they're going to need ongoing assessment.
For more information about the LGS patient and behavioral issues, browse within livingwithlgs.com.